and welcome. My name is Claire Davis and I'd like to welcome you to this Children's Nursing Development Unit Journal Club session. A particular warm welcome to those joining us for the first time. Are you watching this today alone or have you gathered with a group of colleagues? If you're not with others today, consider gathering a group next time so that you can consider the questions provided at the end together. You may also be interested to know that you can access all of our past Journal Club sessions through our website. You can see the link here on the slide. You may find a journal article there particularly of interest to you and your clinical setting. But for today, let's get going. This month's article is titled Prevalence, Risk Factors and Perceptions of Caregivers on Burns Among Children Under 5 Years in Kisenyi slum, Kampala, Uganda. It was written by Tsumi et al. And published in the journal called Injury Epidemiology in 2022. Let's start unpacking the article by first looking at the introduction section. The authors start by noting that burn injuries are a global health problem, accounting for 180,000 deaths annually, the majority of which are in low and middle income countries, and almost 2/3 are in the WHO Africa and Southeast Asia region. Approximately 1 million burns occur in sub-Saharan Africa annually, which collectively lead to a significant amount of morbidity and mortality. Children under 4 have disproportionately higher mortality in comparison to other age groups of children and adults. 85% are caused by scalds and have consequences such as pain, disfigurement, emotional trauma and disability. In Africa, a consequence of death is also more likely. Most injuries happen at home, with those living in informal settlements at a greater risk, which is thought to be due to the presence of hazards that are hard to eliminate in these settings, in addition to the normal, inquisitive, adventurous, curious nature of children. Existing research on burns focuses on all age groups and on hospital data. Injury data, specifically in Uganda, is not often focused on burns in children, particularly those at home, and it is noted that since only severely injured children present at hospital, a community survey is needed. So the aim of this study is to establish the prevalence of burns among children under 5 years at household level in Kisenyi slum in Uganda, together with the associated risk factors and perceptions of caregivers due to their role in the prevention of burns at home. We now move to consider the methods that were used in this study. Now, this study was a cross-sectional study, which means it was observational research that collects data from a population or a representative subset at a single specific point in time. In this population, the target population was children 0 to 5 years, and so their caregivers were used as their proxy. They were the ones that supplied the information. The setting for this study is Kisenyi slum in the central division of Kampala city in Uganda. This is a highly populated area where small-scale businesses are the main income. There is permanent and traditional housing. A stratified sampling method was used to select households from that area that would be then approached to participate, and the consenting adult found at home at the time then becomes the proxy reporter for the child. Community health workers approached each household, not returning if after 3 times they gained no response. On gaining a response at the household, first it was identified if there was a child under 5 and if they had sustained an injury in the past year. If no injury had occurred, they remained in the study as the denominator. If there was more than 1 child in the house, then the most recent injury was considered, and if there were multiple injuries in the past year, the most recent was reported in this study. A quantitative questionnaire was then asked of each caregiver, and an observation was conducted of the home using a checklist. In addition to this, 6 informant interviews were held. These interviews were conducted with an adult mother, a teenage mother, a community health worker, a health practitioner, a father, and a local leader. They were asked questions about perceived risk of burns in their community, causes of and reasons for childhood burn injuries, cultural beliefs about burn treatment and care, prevention and safety measures, and proposed design measures to increase childhood safety from burns within the community. All the data was then gathered together and statistical analysis was conducted on the quantitative, the number data from the questionnaire, and thematic analysis was conducted on any of the qualitative data. Thematic analysis essentially means that the commonalities in what people said were noted from the transcripts of the interviews and then grouped together. Starting to look at the findings of the study, we'll first take a look at the demographics of the children. 420 children were included in the study, and just over 50% were boys. The mean age of the children was 2.9 years, and 70% of the injured children were between 2 and 4 years. 92% of reporting caregivers were women, and 90% were biological mothers to the children. 91% of the households were self-employed. Looking at the data about the burns, there was a prevalence rate of 32%, with hot liquids, scalds, and hot solids being the most common cause. Fire was the least common at just 17%. Nearly half of the injuries occurred outside the home, and many were in the afternoon playtime. Children between 2 and 5 years were 3 times more likely to suffer a burn than those under the age of 1 year. Those with single parents were 1.5 times more likely to suffer a burn injury, but those born to migrants and from those from less poor wealth quintile had lower risk of burn injury. In households where flammables were safely stored, the likelihood of an under 5 burn injury was lower by 39%. And it's worth noting that no statistical association between child burn injury risk and households that had a raised cooking place existed. 4 themes emerged from the analysis of the qualitative data. The first was the main causes of burns, and they spoke about overcrowding, the use of open cooking stoves without demarcated cooking areas, caregiver negligence, and limited space being key. Age was another theme, noting that children of crawling age were thought to be at a greater risk. In terms of first aid, that was the third theme, they spoke about home remedies, aloe vera plants, sap, flour, urine, sugar, burnt sack and toothpaste, that they all believed reduced burn severity, alleviate pain and prevent infection. Treatment at health facilities was considered a last resort when the local remedies failed. The last theme was prevention, and they spoke about reinforcement of laws relating to lighting and cooking, a preference for solar energy, discouraging the use of candles, raising cooking area places, having set cooking areas, and providing community health education. In the discussion section of the article, they reflected on key findings and related them to existing research. They spoke about how the study findings highlight the public health risks associated with childhood injuries that emerge from living in slum settings. They noted that the prevalence in their study was higher than in other similar studies, and rationalised that this could possibly be explained by more recent vast rural to urban migration. They noted that the age range was similar to other studies, reinforcing the need for health education to caregivers of children of this age and consideration of urban planning to ensure the health and safety of children at a household level. They noted that the increase in prevalence in single-parent families and the decrease in migrant families could be explained through the associated amount of supervision that these two situations brings. They also noted the negative association between wealth quintile and prevalence in that it is different to other studies. They also noticed the absence of association between burn risk and a raised cooking area, surmising that this could be that burns were occurring outside of the direct cooking period. And lastly, they identified a need to educate and demystify myths about burn management, both traditional and Western, and engage urban planners on demarcated areas for child play and for cooking. So in conclusion, this study revealed a high prevalence of burn injuries in children under the age of 5 in an urban slum setting. The injuries were significantly associated with child, caregiver and environmental factors, and in response the authors advocate for modifications to households and for health education about prevention and pre-hospital care of home burn injuries for caregivers with children under the age of 5. Right, so that's the end of the article, and I advise you all to take a few moments to think about all that you've heard. Then start to consider the reflective questions that are here on this slide. First, think about what you learnt from this article. Were you surprised at the prevalence and frequency of different types of burns? Think about your rationale and thoughts behind your answer to that. Then think about if the results would be similar if you conducted a similar study in a similar location near your hospital or clinic. And then lastly, what that makes you think about the need for health education of caregivers in your area. That's a wrap. Thank you for listening. I hope it was interesting to you and that you are now excited to access the new journal club that will be released next month. Look out for it on all our social media platforms. Bye for now.